There's a good reason why every doctor's appointment starts with a blood pressure check. While 1 in 3 American adults has high blood pressure, about 20% of people are unaware that they have it because it is largely symptomless. In fact, most people find out they have high blood pressure during a routine office visit. Blood pressure is the force of your blood, as it flows through the arteries in your body. Arteries are blood vessels that carry blood from your heart to the rest of your body. When your heart beats, it pushes blood through your arteries. As the blood flows, it puts pressure on your artery walls. This is called blood pressure. Blood pressure is determined both by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. The more blood your heart pumps, and the narrower your arteries, the higher your blood pressure. A blood pressure reading is given in millimeters of mercury. It has 2 numbers. The top number is the systolic, which measures the pressure on the blood vessel walls when your heart beats. The bottom number is the diastolic, which measures the pressure on your blood vessels between beats when the heart is at rest. According to guidelines from the American Heart Association and the American College of Cardiology, a reading below 120/80 is classified as normal blood pressure. Those with a blood pressure reading anywhere from 120/80 up to 129/80 are classified within a category called elevated blood pressure. Hypertension is defined as a reading of 130/80 or higher. High blood pressure, hypertension, is a common condition in which the long-term force of the blood against your artery walls is high enough that it may eventually cause health problems. Many different things can cause high blood pressure. Most people with high blood pressure have no signs or symptoms, even if blood pressure readings reach dangerously high levels. You can have high blood pressure for years without any symptoms. A few people with high blood pressure may have headaches, shortness of breath or nosebleeds, but these signs and symptoms aren't specific, and usually don't occur until high blood pressure has reached a severe or life-threatening stage. Uncontrolled high blood pressure puts you at a higher risk for stroke, heart disease, heart attack, and kidney failure. What causes high blood pressure? For most people, the cause of high blood pressure is not known. However, it is clear that various conditions and behavior make high blood pressure more likely. These are known as risk factors, and include leading a sedentary lifestyle, with little or no exercise, smoking, being overweight, a diet with a high salt intake, high blood cholesterol, a family history of high blood pressure, high alcohol consumption, and diabetes. In a few people, there is an identifiable cause, such as narrowing of the arteries to the kidney, or some hormonal conditions. How is high blood pressure diagnosed? Fortunately, high blood pressure can be easily detected. And once you know you have high blood pressure, you can work with your doctor to control it. A single reading showing high blood pressure doesn't mean that you have hypertension. Sometimes, blood pressure needs to be checked several times over a period of days or weeks to know if someone has hypertension. Your doctor will probably weigh and measure you. He or she might do urine tests or blood tests to check for other conditions that can cause hypertension. Some people have what's called white coat hypertension. This means that their blood pressure goes up when they're at a doctor's office because they're nervous. When they feel more relaxed, their blood pressure usually goes down. To make sure high blood pressure readings aren't caused by anxiety, doctors will sometimes track a person's blood pressure over a whole day. This is called ambulatory blood pressure monitoring. What is the treatment for high blood pressure? Mild high blood pressure can often be treated by making lifestyle changes, including doing regular physical activity, stopping smoking, improving your diet to reduce salt, reduce fat, and eat plenty of fruit and vegetables, losing weight, and limiting your alcohol intake to no more than 2 drinks per day for men, or 1 drink per day for women with high blood pressure. The best way to lower blood pressure begins with changes you can make to your lifestyle to help lower your blood pressure and reduce your risk of heart disease. Additionally, your doctor may prescribe medicine to lower your blood pressure. These are called antihypertensive medicines. Living with high blood pressure. Controlling your high blood pressure is a lifelong commitment. You will always need to monitor your weight, make healthy food choices, exercise, learn to cope with stress, avoid smoking, and limit your alcohol intake. If you need medicine to control your high blood pressure, you will likely need it all your life. Additionally, you will need to get used to regular blood pressure checks. Your doctor may want you to come to the office regularly. Or you may be asked to check your blood pressure at home and keep track of your numbers for your doctor. Some pharmacies and retail clinics have blood pressure machines on site. You can buy your own automated arm blood pressure cuff for use at home. Your doctor may want you to check your blood pressure several times a day. If you have high blood pressure, it's important to know that you're not alone. It's important to find support from the people around you and healthcare professionals. Make sure you check your blood pressure and keep a diary of your readings regularly, so you can see your progress. If you can follow a healthy diet, keep to a healthy weight, and avoid smoking, you will reduce your chances of having high blood pressure. We hope you loved this video. If so, please share this with your friends or teammates on social media.